Welcome to this episode of Tubules Live. Today we are very privileged to have Dr. Raj Ahluwalia with us. Raj is a general and implant restorative dentist. He's very enthusiastic about teaching and is a visiting faculty, mentor and advisor for the Pankey Institute in Miami. He also enjoys facilitating small educational courses both in the UK and internationally. Whilst not teaching, he also works in general private practice, both in Bedfordshire and Harley Street. So, today's topic is comprehensive functional aesthetic dentistry, the keys to predictable success. So, without further ado, I'd now like to hand over the floor to Raj.
Thank you. Thank you very much, Rena. Thank you, everybody here in the audience. Thank you, NSK, for this wonderful opportunity and this place where giving this talk in. And thank you to Dental Tubules Live for inviting me. And welcome everybody watching online. So yes, today I'm going to talk about comprehensive functional aesthetic dentistry, and hopefully I can give the opportunity to see some of the key skills that I feel I've learned over the years, which helped me to achieve a little bit more predictability in my dentistry. And with a bit of luck, I'm hopefully going to give you some of those skill sets to think about today. So I am a general dentist. I work most of the time up in Bedfordshire, which isn't very far from NSK's facility here in Stevenage. I've been there since I graduated, actually. I started there as a vocational trainee 22 years ago. Been there ever since, and dabbled with working in Harley Street along the way. So Biggleswade, a small market town, very average people, and what we do there is just very average daily dentistry. But being a rural market town, I found myself lacking in specialists over the last 20-odd years. And so I found that for the ability to serve my patients fully, I had to go out and learn a lot of the skill sets I didn't quite get delivered from my dental school. So it's been a long journey, a passionate journey of continuing education to hopefully get to where I've got today. And I'll tell you a little bit more about it. Along the way, I found that I couldn't offer my patients the level of service I wanted to within the NHS. So back in 1995, we quit the NHS and became a private dentist. At the time, I felt that that meant I had to know more about cosmetic dentistry, so I started to label myself a cosmetic dentist. Learned to do veneers, all the usual things that everybody was learning back then who were also wanting to quit the NHS. And I was doing this sort of dentistry where we were taking people with severely, damaged teeth and restoring them primarily with veneers and crowns, and got a little bit noticed. Ended up doing a small TV show that some of you might have heard of, Extreme Makeover. And started to attract more and more attention from patients seeking cosmetic dentistry. But what I found along the way was I didn't feel I was enjoying the dentistry as much on the cosmetic side. I actually enjoyed the reconstructive side more. And I also felt that there was still something missing from my overall dental package. And I started to have a little bit of a crisis of conscience between the aesthetics and the ethics. And nowadays that has become more of a hot topic in the cosmetic dentistry world, with people veering more and more away from veneers and doing more bonding and orthodontics. But I was learning all this, a good 10 years ago, that I had to get away. So it was about that time that I decided to go out to Miami and went to the Pankey Institute. And it was there that I met some of my best friends in dentistry today, who were my mentors and advisors and tutors at the time. And one of the most profound things that I learned was when Steve Ratcliffe, who at the time was the chair of education, put his hand on my shoulder and he said to me, "You don't yet know what you don't yet know." I thought I was an amazing dentist at the time. I was doing a lot of cosmetic dentistry, had a TV show. But to hear these words and have them resonate with what I was already feeling, that there was something not quite right with the dentistry that I was doing, that phrase has stuck with me ever since. And so I would urge you to just ponder that for a moment, that there is a lot out there to learn in this wide and beautiful profession of ours, and most of us don't know what we don't yet know. We don't even know that we don't know it. So with a bit of luck, today I might give you a few ideas of things you might wish to pursue in your continuing education. So I went away from Pankey thinking I want to get away from the cosmetic label and decided to devote my time to becoming an implant restorative dentist. Studied that for many years and grafting, and that's where I now see myself. I moved away from the cosmetic side. So nowadays I tend to see patients who come in like this, just regular ordinary people who've basically either been let down by their dental experience or fear of dentistry, or for whatever reason have let their mouths go, and we try and build them back some confidence in their smile by restoring them back with fixed implant restorative work, and that's where I enjoy my dentistry today. Now, it doesn't matter how amazing your bone grafting skills are, your sinus lifts are, or how fantastic and guided your implant placement is. At the end of the day, all the patient really sees is how pretty it is. So I still appreciate all the cosmetic learning that I did earlier on in my studies, because without having a good foundation in the cosmetic, it doesn't make any of the dentistry that you do look any good, no matter how difficult it was. So always you have to still marry the technical with the aesthetic. So for me, dentistry is as much an art as it is a science. And we get the same kind of patients coming in week after week, and I'm sure you all do in your own general practices too, patients that you know have got mouths that are essentially hopeless. And how do you even begin to restore them in a humane, caring and compassionate way to end up achieving a result that they can then be proud of? So for me, the Pankey Institute was one of the most important stepping stones in my career, and if I hadn't have gone there, I don't think I'd be in the position that I am now.